Frequently, I get questions about food testing. Many people have been hearing about and researching food allergies and food sensitivities. I get questions like, should I be tested? Are food sensitivities and allergies the same thing? If not, what kind of test should I do? My name is Dr. Sharon Borkowski, and I am a functional medicine doctor here at Naperville Integrated Wellness. Over the next few minutes, I'm going to share about the different types of testing, about some of the pitfalls of testing, as well as keys to getting the most out of your testing in the context of a functional medicine model. Now, testing for allergies is an important part of food testing. This is the type that is typically done by an allergy specialist. The most effective way to test for allergies is a blood test, and this is done to detect IgE antibodies. Now, IgE antibodies are important, and in the case of food responses, indicate that we should avoid that food permanently. Food sensitivities, on the other hand, are testing for IGA and IGG antibodies. These types of antibodies are found based on exposures and can change over time. Allergy doctors test only for IgE antibodies. Functional medicine doctors will often look for both allergies and food sensitivities. In summary, there are two different types of food testing: food allergies and food sensitivities. Allergy testing identifies IgE antibodies, and food sensitivities test for one or both IGA and IGG antibodies. Next, I will share some of the pitfalls commonly associated with food testing. The first pitfall is low quality testing. You want to be sure that you have a reputable facility doing the testing. Low quality testing leads to ineffective treatment strategies. The second pitfall is not all types of antibody testing is the same. Certain foods may not be identified with only using IGA or IGG. The third pitfall is having a practitioner who lacks understanding on how to interpret the results of the testing. Now, as a quick recap, the first pitfall is utilizing low quality testing. The second is not using the right type of testing. And then the third pitfall is not having an experienced provider interpreting the results in order to come up with the best treatment plan for you. Finally, I'll share some keys to effective testing. Now, first, always use a high quality facility. Second, you should find a practitioner who utilizes all three types of tests. And finally, you should also find a practitioner who knows how to interpret the testing in a way to look for patterns to create the most effective plan that has the greatest chance of success. Visit NapervilleIntegratedWellness.com for more information. Thanks for listening.